I am so excited tonight. We are talking about asthma, and we're going to talk about how CBD can assist those people who have asthma. But my special guest tonight is my very, very dear friend. She is like a sister. We've been friends since our freshman year in high school, which was only what, 2 years ago? We graduated
Yes,
from high school.
yes, we're overachievers.
We're overachievers, right? So this is my very dear friend, Vanessa Beavers. And I wanted her to come on tonight because this is someone who has lived with asthma all your life,
Since 10 or 11, I think,
10 or
something
11,
like that.
and you're
Yeah,
only 21 right now, right?
right. So
So
forever.
I want everybody, thank you, Ernestine. I want everybody to put in the chat, welcome Vanessa. We call her Vinny. So say, welcome, Vinny. And thank
Hi,
you
everybody.
Thank you for spending a little time with us before I get into my formal presentation, but I thought it was really important for our distributors and our guests to hear about what it means to live with asthma, what challenges you've had, and just tell us your story.
Okay. As Rita was sharing, I've had asthma probably since puberty, around that time. It wasn't that bad when I was growing up. I didn't really have a whole lot of problems. But when you get out of your from under your parents' care, and you start living your life, things come up. And I found out that I was really allergic to cats. That was like what sent me over into just a cycle of emergency room visits, really bad. But unfortunately, I didn't react to being allergic to cats for maybe 12 to 18 hours after exposure. So it took a long time to figure out that was my biggest trigger. The one thing I did want to share with everybody is I found it really important to develop a team of healthcare professionals to help you maintain your health. I was lucky to have been introduced to a pulmonologist who I was under his care for at least 25 years until he retired on me. So I'm looking for a new pulmonologist. I also was under the care of a general physician, an internist, for my entire adult life, from the time I got out of college until just 2 years ago. So, and she retired. So all my healthcare people are just abandoning me. So I have to line up a whole new team of people to keep me well. But I don't really have a lot of issues with my asthma anymore because I take my medicine and I watch my triggers. So my primary medicines are a rescue inhaler. Everybody who's got asthma of any kind probably is familiar with albuterol, which is a rescue inhaler that you use as needed when you experience tightness or something like that. And then if you have chronic asthma, or if you have an ongoing issue with it, then you have a maintenance inhaler. And I use Flovent, or the generic version of Flovent, which works best for me. Advair does not work. Advair does not work for me, even though it's very widely advertised. It's not one of my favorites. So you have to pay attention to your health, to know what your triggers are, and to anticipate, like this time of year is pollen season. There's a lot of mold, pollen, dander, whatever outside. So all the things that they tell you to do for allergies, you have to really do for asthma. Cover your head and not bring pollen in the house. Change your clothes. Don't walk around your house with, outside clothes on, because they have all the, the outside elements all over them, which is going to end up making you not feel well. I'm trying to think, what else can I share?
You're going to share about the shortness of breath. You're going to share about when you have an asthma attack.
Okay.
What that is, how that affected your life.
Oh, okay. Thank you. And truthfully, I have not had an asthma attack in it's been at least 10 years. I can't even remember the last time I had what my pulmonologist called an episode. That's what he called them. And that's because I take my medicine and I avoid my triggers, and I try to, keep my overall health up there, well. So, but the shortness of breath is it's very anxiety inducing, because I mean, if you have asthma, then you know what it's like to feel that tightness in your chest and you can't quite catch your breath. And then if it lasts long enough, then you get all the muscle soreness in your chest and all the muscles that wrap around your rib cage and your back. Because and what asthma, if you're not familiar with it, what it actually is not that you can't get air out or get air in. You can't get the air out, so you can bring in more air. So your body, it works really hard. Your muscles hurt so much because you're trying to exhale the air so you can take in fresh air. And then, of course, you'll get lightheaded and you'll just be exhausted because you need air for energy. And then, of course, the amount of oxygen that's in your blood is low. So your overall health will just deteriorate to the point where, when I was really sick in graduate school, I couldn't do much of anything. I basically would go to school at night, work, and spend the rest of the time trying to breathe, propped up on the couch, propped up in bed, just trying to exist, until, thank God, we found medicine that was able to subdue my asthma and allow me to live a regular life. So I guess the most important thing for me to share is for you to get your asthma under control, because once you do and keep it under control, then it's easier to maintain that. But when I was having the most trouble, I would get better, but not all the way well. So the next time I experienced like grass or a cat or a dog, it would send me spiraling into this cycle of an emergency room visit, because I was never 100%. So the important thing is, now that, like, for example, it's allergy season, it's pollen season. So if you know you have to go outside, the windows are open in the car, it's like maybe you need to close the windows in the car, get the filter that filters the air for your car. Try to avoid driving through the forest preserves. And if you have asthma that's maintenance, then, or medicine that's maintenance, take your medicine so that your triggers don't start. Because just like anything else, once you're sick, you have to work really hard to get well, but to stay well is a lot easier. So just to think preventatively. My internist recommended that, even though I wasn't ever diagnosed with exercise-induced asthma, she recommended that I take one puff before I started working out, and then give myself extra time to warm up so that my lungs could acclimate to the stress of working out, so that I didn't get in the middle of a workout class and have to get out of breath, and no, it's not regular out of breath from working out, but it's asthma out of breath, and be like, oh, where's my inhaler? And in a panic and have the anxieties. She's like, be preemptive, take a puff, spend an extra 10 minutes warming up before you go to kickboxing class or spin class, where you're going to be really pushing yourself. And then you can enjoy yourself because your asthma is subdued. So I guess that's the best thing I could offer, is to be preventative and to get a good medical team behind you that really listens to your concerns and pays attention to your health. My internist, like I said, she was wonderful, and she was always on top of it. Allergy season would hit, and she would send me an email and just check on me and say, are you okay? Do you need anything? Are your scripts all up to date? Let me know. Do you need a referral for a new doctor? She was always very proactive to keep me out of her office, to keep me from calling her or her nurses in the middle of the night. I'm sick, so I don't know, Rita, did you have anything else you wanted me to comment on?
No, that was really good. The important part is we always remind our guests and our distributors never to stop taking their medicine, right? Always take your medicine. And tonight we're just going to transition to how you can use an alternative, a CBD product, to assist with the symptoms. We're not saying CBD will cure your asthma. We're not saying stop taking your asthma medicine and take CBD. What we are saying is that I want you to really lock in to what Vanessa said. She said words like anxiety. She said words like pain, stiffness, chest pain, muscle, you know. This is when CBD comes in. CBD can assist with the symptoms that many asthmatics have, right? So lock into inflammation, lock into the word anxiety, muscle spasms, muscle cramps, muscle pain, chest pain, you know, all of those things CBD can assist with.
Excuse me.
So I want to thank you, Vanessa. And again, the intention of sharing her story is that when we go over the next part, my presentation, you're going to say, oh, okay, now this makes sense. Because I actually heard from someone who has asthma that absolutely will now give you clarity when we talk about this disease, the process, and how we can assist with CBD. So thank you, Vinny.
You're
Thank
welcome.
you so much. We love
Take care, everybody.
Say in the chat. Thank you, thank you, thank you.
Oh, I see. Oh, okay. I see Erica's daughter has exercise-induced asthma.
Yeah.
Yeah, that's very scary. But you know, if she can, and I don't know how old she is, especially if she's a teenager. A lot of times they don't want to take their medicine. And I get that. And I don't know if she has a, what do you call it? I can't think. You know that it's a tube that you can puff into, Rita.
Oh,
no, I can't think of what it's called.
Flow meter.
A flow meter. Yeah.
Right.
So that will help you with your anxiety, because sometimes you think, you know, in your head you start, oh, I'm out of breath, and then you look at the pulse and you're like, oh, I'm fine. There's nothing. I'm just, you know, anxious. It's all in my head. So it's nice to have a objective measure of how you really feel. Just like if you wear, you know, your heart rate monitor, you might feel like I'm really, really working out, and you look and you're like, oh no, I'm not. I'm not really doing anything. I need to push myself. And then sometimes your heart rate monitor says, you're having a heart attack, slow down. And you're like, no, I'm not having fun. So yeah, it helps to use that I can't think of what it's called. It's like an oxygen meter, and they're very inexpensive. It's not you just blow into it and the meter goes up to tell you how much oxygen.
Yeah. The incentive spirometer. Incentive. That's what it's called.
That's what it's called. Okay. Yeah. Obviously, I don't use mine because I don't even know what it's called, but I do have one, and it does help with that anxiety. So, and you don't want to over medicate either. You don't want to be holding on to your inhaler all the time, like a, you know, security blanket. But thank you, ladies, for taking the time to listen to me. I know
there's some gentlemen on here too.
Oh, I'm sorry. I can't see. All I see is Erica and Marguerite. But brothers, take care of yourselves. Your health is important. Stop trying to carry the weight of the world on your shoulders. It's not that serious. All right, I'm going to sign off.
Thank you, Vinny.
God bless everybody. Take care. Be safe.
Thank you so much. So I'm going to share my screen now. Let's see here. And we are going to really delve into CBD and asthma. So what we do know is CBD has been shown, lots of data I'm going to share with you and information to assist with symptoms of asthma. We do know that if you're new on the line, there is 2 different species of cannabis, right? We've got the marijuana, as you can see on the right, has high levels of THC and low levels of CBD. And on the left, what we have is the hemp species. Now, the hemp species has low levels of THC and high levels of CBD. So THC is a substance that gives you the high. It gives you the paranoia. It gives you the euphoria, right? And so if you are asthmatic, we don't want you to be high or paranoid because it's already an anxiety-provoking sort of condition. We want you to get that health without the high. So the CBD that we're going to be referencing tonight is sourced from the hemp plant. You can see the difference. The hemp plant grows up to 4 meters tall. Marijuana grows about 2 meters tall. We also know that the growth cycle is about 90 days in marijuana, 120 days in the hemp plant. But there are many other industrial uses as well as medicinal uses that hemp can be used for. And it's non-psychoactive. So those are the main differences. But number one is that marijuana gives you the high and hemp is non-psychoactive and will not get you the high. So CBD is an abbreviation for cannabidiol. It's the number one compound that's naturally occurring in the industrial hemp plant. In fact, it is the second most compound found in the marijuana plant. But again, we are going to be talking about CBD sourced from hemp tonight. So let's look at the medicinal properties, but let's really focus on CBD and its medicinal benefits as it relates to asthma, because that's what we're talking about tonight. So CBD is an antibacterial. You know, many asthmatics can have a flare or an asthma attack if they have an infection, if they have a bacterial infection like a pneumonia, or even a viral infection like COVID. It also helps to reduce inflammation. And we're going to talk about, and we always talk about this, guys, that the culprit in every chronic illness that we see today, the bottom line is inflammation. So there is inflammatory process going on in the bronchioles of the lungs. It also helps to reduce anxiety. CBD does. It relieves pain. It suppresses muscle spasms. So I think you guys know where I'm going, right? Some of the same symptoms that Vinny talked about, CBD can address: anxiety, pain, inflammation, bacterial infections, viral infections. And then there's other cannabinoids too that the plant makes, like CBG and CBC and Delta 8 THC and Delta 9 THC. You all see that they also have medicinal benefits in helping to reduce pain and inflammation. And the synergy of all of these compounds is really what helps make those who have asthma get relief from those symptoms. So again, the benefits of CBD oil ranges from benefiting the intestinal tract, the spinal cord, the brain, the eyes, the stomach. It's anti-tumoral, cancer, and even asthma. So we talked about with Vinny how asthma is a respiratory disorder. This is when the airways become inflamed, they become narrow, they cause pain when this happens. It causes coughing. And in severe cases, like she said, it makes it very difficult to breathe. Can you imagine having an onset of an asthma attack and the doom that you could feel by not being able to breathe? And that's what a lot of people who get COVID, now they understand how asthmatics feel, right? And so we talked about with Vinny, you know, her doctors put her on inhalers. Some people have to be on steroids, but we do know long-term use of steroids can cause an acceleration of bone loss. So there's a lot of long-term side effects that asthmatics have to deal with. What they found is that CBD is able to reduce the frequency of asthma attacks. Why? Because it's an anti-inflammatory. It helps to reduce inflammation, it helps to reduce the muscle spasms, and it really helps to manage these symptoms better for patients. So when we look at what's going on in the lungs, if you remember anatomy, there's 2 lobes in the lungs, but it's really these areas called the bronchioles. These are the tubes that are giving the oxygen to the lungs. These are the areas that become inflamed. These are the areas that become constricted so that the blood flow is now impaired. So asthma signs and symptoms: shortness of breath, chest pain, wheezing, trouble sleeping. Why? Because they're short of breath, they're coughing, they're wheezing. It's really hard for them to get a good night's sleep as well. Now, Vinny talked about her triggers. She found that it was a cat is really what triggered her asthma. But there's also other triggers like grass. Erica talked about her daughter, exercise induced, other pollutants, dust, pollen, illnesses. So a trigger could be a viral infection or a bacterial infection, different medications, pet dander, dogs and cats, stress, weather, and smoke. So when we look at the types of asthma, there's so many types of asthma, but these are the main types. Adult onset, of course, you can have a child that has an onset of asthma. There's allergic asthma. There's asthma with a COPD overlap. That really means that now the lungs are being really affected. So COPD is not a good sign. There's exercise-induced bronchoconstriction. So the bronchioles become constricted and tight. There's non-allergic asthma, and there's occupational asthma. So again, when someone is going through an asthma attack, this is what's happening in the bronchioles. There's a lot of mucus that's built up. There's a lot of inflammatory cells that start to invade these bronchioles and makes it hard for air to be exchanged, makes you short of breath. So CBD, when we talk about how it works in the body, it's actually modulating and regulating the immune system and the nervous system. Why? Because we talked about how an asthma attack can cause a lot of anxiety. Anxiety can also increase the symptoms of asthma. You just can imagine if you feel impending doom that you cannot breathe, you're going to become very, very anxious. So CBD comes in, it reduces the inflammation. CBD comes in and reduces the stress and anxiety. It also comes in and plays a very important role in the immune system so that the immune cells that cause inflammation are also reduced. It's almost like when we talk about autoimmune patients, fibromyalgia and lupus, and they have a hyper-reactive immune system. It's almost like the immune system thinks that the lungs are foreign and they start attacking the lungs. Well, this is the same thing that's happening in asthma. And how does it work? Well, CBD works by binding to receptors that are in our body, and they're binding in a system called the endocannabinoid system. Now, this is the system that keeps our body in balance. It keeps our body in homeostasis. And so these receptors are found in the lungs. They're found in the liver, the bone, found in the brain, the central nervous system, the skin, the eyes, the stomach, the teeth. There are receptors literally in every organ and gland in our body that's looking for cannabis products like CBD and THC and CBC and CBG, looking for these compounds to put the body in balance. But specifically tonight, the lungs and the receptors in the lungs are now able to bind to the CBD, so CBD can go in and reduce the inflammation and reduce the symptoms that those who have asthma. So CBD actually works on CB1 and CB2 receptors. There are a lot of other receptors. I'm not going to bore you with them, but there's a lot of other receptors like the CPR55 that has been studied and shown to have a positive result in those who have asthma. So overall, the endocannabinoid system really plays a major, major role in so many physiological processes, in appetite, digestion, inflammation, pain, the immune function we talked about, spasticity, movement, regulation of stress, mood, and sleep-wake cycle. So that's why you can see someone who has asthma, someone who has these symptoms where they have pain or they have anxiety or they can't sleep. This is how CBD works through the endocannabinoid system. So CBD also may decrease the hyperresponsiveness of the airways. That means that when these airways get hyper responding to a trigger, they go crazy. They get inflamed, they constrict, they start to produce a lot of mucus. This causes a flare, this causes coughing, and it's just a vicious cycle. So when those asthmatics find that it's difficult to breathe, they start tightening those muscles, they start having a lot of chest pain. That difficulty in breathing occurs because of inflammation. And so cannabis, we know, can't replace a steroid inhaler, but we do know it can help to reduce the inflammation. So being on CBD on a regular basis can absolutely help those who have asthma to prevent them from having flares. So it is a preventative measure that they can take. A sudden asthma attack happens when the muscles of the lungs and airways become spastic. They have a spasm, and they have an additional bout of inflammation, and this really causes as status asthmaticus, which can lead someone to be ventilated or intubated on a ventilator, and it can be very, very dangerous. So CBD, again, can come in, reduce those muscle spasms, reduce the inflammation, and we want to do this before someone is on a ventilator or a life supporting sort of apparatus. This is a way that we can help those that we know and love who have asthma to get on these products to help even reduce the number of flares. So again, the long lasting anti-inflammatory properties of CBD is the reason why it helps to control those who have asthma. We're going to talk about our products. You know, our smokable products, our vape, our pre-rolls is not something that I would run to in using in an asthmatic. We have so many other products. Now, if there is an asthmatic that you know that smokes cigarettes, absolutely I would put them on our smokables. And it doesn't make sense. Vanessa, my friend Vinny, was really surprised when she found out that I have patients who are not pregnant anymore, but they're my gynae patients who are asthmatic and smoke cigarettes. And that's just a disaster waiting to happen. So we want to minimize the spasms of the bronchial. We want to minimize attacks. We want to help them with these products here at Wakanna. So again, you know, when we talk about pain, a lot of asthmatics have pain, they have chest pain. We're going to talk about how using our topicals can be a resource to relieve their pain. Instead of using Tylenol or non-steroidals for their chest pain, they can use a topical product. So that leads me into our products. You know, again, the disclaimer is that we don't want to have anyone assume that our products cure asthma. We don't want to make any claims, but what we do want is to have an open mind in increasing the availability of organic, natural, holistic products in addition to your pharmaceutical medications that you're using already for your asthma. And then loop in your physician. Always talk to your physician before starting any holistic products, because you want to ensure that there's no drug-drug interactions. And speaking of drug-drug interactions, there is one asthmatic drug called theophylline. Now, theophylline is a really old drug. I'm not even sure we're using that much theophylline anymore. But theophylline can potentially interact with CBD. It can cause the effectiveness or potency of theophylline to be decreased. So if you happen to be on theophylline, you want to make sure that your physician is getting more current and regular theophylline levels to ensure you're at the right sort of level. The tinctures are products that you use underneath your tongue. And it's a great way to have a steady state in your system if you're asthmatic. If you are working a job where you have random drug screens, we have a tincture just for you. That's our pure tincture. It contains less than 0.0% or less of THC, and it's a great tincture that can be used for asthmatics and for those who have random drug screens. Again, these tinctures, the whole role of these tinctures are help to reduce inflammation, to help reduce pain, and to help reduce anxiety. Tinctures should be taken in the morning and in the evening, 3 drops under the tongue. Twice a day is a great starting way of using our tinctures. We have one tincture that is very, very potent. That's our Hemp MD. That's something I absolutely would recommend for those who have recurrent asthma flares. They have a lot of difficulty during this time, as Vanessa said, during allergy season. I would pair this product with black seed. Black seed is an essential oil that I put my son on. He doesn't have asthma, but he has allergies, along with the CBD tincture to help reduce that inflammation. So black seed, along with these tinctures, are the way to go for asthmatics. We even have a water-soluble product. So if you want to put this power water soluble in your water, in your juice, in your smoothies, this would be a good product for you as well. And then our carrier oil is MCT coconut oil. This is the oil that we use to help get the CBD into the bloodstream. And it also has so many medicinal benefits in helping with inflammation, as well as being a very powerful antioxidant to help to ward off those free radicals. And that's the benefit of MCT coconut oil. So when we look at dosing, you know, that's a big question, like how much do I take? I really recommend that you start low and start slow. Starting low and starting slow will prevent any side effects from taking too much CBD. And even the Mayo Clinic, they also recommend starting low and slow. As you can see, someone with chronic pain, the recommended dosing is as low as 2.5 to 20 milligrams. So when you're doing 3 drops in the morning and 3 drops in the evening, that's about 12 to 15 milligrams of CBD on a daily dose. And typically that is enough for most people. We also have a suggested dosing. Let's say you have someone that's morbidly obese. Well, 9 times out of 10, if they're morbidly obese and have asthma, they're going to need more CBD than someone who is normal weight. So this is another way that you can dose someone that is heavier and has probably a more severe condition of asthma. You can screenshot this graph or this chart, because this becomes important again when you're dealing with a client that is overweight, or maybe you're dealing with a child. You know, children have asthma too, and maybe you have a parent that wants to get their child started on some of these products. So this is a weight by severity chart. Each drop of our tinctures, our power tinctures, are 1.67 milligrams. Each little drop of our pure is 1 milligram, and our Hemp MD is 2.5 milligrams. All of this information is on our website. All of this information is on the bottle in the event you want to dose by weight. Now, another question is, well, how long will it take to work in an asthmatic? Well, what you want to do now is you want to get anyone you know that has asthma on these products so that they don't have a lot of flares. So it really does depend on their weight. It depends on the concentration of CBD, if you're using the 500 or the Hemp MD. It depends on the severity of their asthma. It depends on their body chemistry. It depends on their diet. Let's talk about diet and asthmatics. If you are an asthmatic, or if you know an asthmatic, they absolutely need to be off dairy. Dairy causes an increase of mucus production. An increase in mucus production is no good for an asthmatic's bronchioles. It's going to cause a decrease in air exchange. So you want to get them off of dairy immediately. You want to get them started on our tinctures, our other products we're going to talk about. Absolutely, you want to throw in that bottle of black seed oil. And then it also depends on your tolerance. All of these things are factors that impact the effectiveness of CBD. So you can't really tell someone, well, this product is going to work in a day. It could, or it may take a month or 3 months. It just depends on a lot of these factors. So when we talk about using CBD tincture, it's really important to know that if you're on medication, to space out the medication and your CBD oil tinctures, your gummies. You want to space them out about 2 hours. So if you wake up in the morning, you know you have medications to take your medications. 2 hours later, you're going to use your products. So when we talk about our culinary product, we actually have a product that you can bake and cook with. And what's so lovely with this is that you can really get creative in how you're consuming CBD. You don't always have to put it under your tongue as a tincture. When you're baking and cooking with CBD, just make sure you're not baking over 350 degrees. Why? Well, if you bake over 350 degrees, you can burn off all the potency of your CBD product, right? So you just wasted your money. The second thing, if you bake or cook over 350 degrees, it can cause a bitter taste. So you don't want to have a bitter taste, and you don't want to burn off all your product. Start low and slow. Even when you're baking and cooking, start low and slow. 3 drops is enough if you're baking and cooking something in the morning. 3 drops is enough if you're baking or cooking something in the evening. Now, our pure tincture is a tincture. It's not a water soluble. I know Dr. Rita still hasn't changed the slide, but our pure tincture is a product that you're going to take and refer for those who have random drug screens. Or you may have someone that tells you they are sensitive to THC. So because this product has less than 0.0% or less of THC, this is a perfect product for those people. 3 drops in the morning, 3 drops in the evening will give you 6 milligrams of CBD. This also has a special technology. It's called nanotechnology. Nanotechnology just helps move the CBD more efficiently into the cell. So this product is 98.7% bioavailable to the cells. Now, again, a disclaimer for me, I would not personally recommend an asthmatic to smoke CBD, but I would recommend an asthmatic that smokes cigarettes to smoke CBD. Why? Well, because CBD can help to reduce the cravings that asthmatic has for nicotine. It can also help the withdrawal symptoms that those who are coming off of cigarettes have. So yes, the only exception would be an asthmatic that smokes cigarettes. You would want to use our smokables, either our vape cartridges or our pre-rolls or our flowers. I've had several patients who have smoked cigarettes that have now reduced their consumption. Some have even come off of smoking because of these smokable products. So I love the Hypnotic. You can see I have it right here. When I was coming to the hospital, I was this close to a very, very bad accident. Guy lost control of his truck and his truck flipped over right in front of my eyes. So you know, I got to the hospital and started vaping. I love the Hypnotic vape because it has the peppermint in it. I love peppermint. It's a great product that works fast. Within 1 to 5 minutes, I was able to calm down. Really bad accident. The cartridge comes in Raspberry Jane. We also have our new Delta 8 cartridges. Our Delta 8 is the new kid on the block. It's great for reducing inflammation, but again, I wouldn't use smokable products on an asthmatic unless they smoke cigarettes. If you are sensitive to THC, Delta 8 probably will not be a great product for you because it has the potency of THC. It's legal, but it gives you that feeling of intensity. So Delta 8 is for those who are not sensitive to THC. Again, more is not better. When we talk about Delta 8, you really only need one pull on those cartridges to get an effect. We always talk about the fact that many people are hesitant when it comes to vaping, right? They're hesitant about vaping. Why? Because in 2019, we had that issue with several people dying from vaping. Now, they were not vaping our Wakanna products, but they were vaping products that were filled with very harmful substances and ingredients. They were filled with nicotine, cutting agents, additive, pesticides, opioids, rat poison. But really what killed a lot of people was the addition of vitamin E. Instead of using a carrier oil like we use at Wakanna, which is MCT coconut oil, they use vitamin E. And vitamin E is toxic to the lungs. When you inhale vitamin E, it becomes very toxic, and unfortunately, there were a lot of deaths. So our vape cartridges don't contain any additives like nicotine, cutting agents, fentanyl, anything harmful, or vitamin E. That's really important for you to know. Now, our edibles are amazing. They are a great way to consume CBD if you're an asthmatic. They will do the same thing for you as our other products. They will reduce that inflammation. They will reduce that anxiety. They will help the pain. They will help you sleep as well. So we have a line of our power gummies. That is the full spectrum line. Whenever you see the black label, that means it contains the legal limit of THC. And then we have our pure line, which contains less than 0.0% of THC. We also have edibles that you can consume CBD in coffee. It's a great way to consume CBD is our flat belly coffee. Many asthmatics are overweight, quite honestly. Some aren't, but some are. All of that inflammation from fat cells, inflammation within the lungs, we need to get their weight down. So that is a great product for those asthmatics. We also have spices. We have butter. There are so many ways here at Wakanna that you can consume CBD by using it in your food. So these are great products. They are power products. So if you have random drug screens, these spices cannot be used by you if you have random drug screens. So again, gummies take about 45 minutes, sometimes an hour to get into your bloodstream. So start low and start slow. You want to start off with half a gummy. You want to start off with a fourth of the gummy if you're using our Flight 50 or Flight 25s. Start low and slow with everything and know that you can always increase the dose. Again, gummies take about 45 minutes to an hour to get into your system. So don't do like a lot of people. They just start eating all these gummies, thinking that it's not working, and then they become very fatigued. Topicals are really important to use in asthmatics. Why? You heard Vinny say the anxiety causes a lot of tightening of the muscles, right? A lot of chest pressure, a lot of muscle spasms. These topicals would be great to apply topically to the area that's causing discomfort and pain in asthmatics. We have a cream, our Power Extreme Relief Cream. We have a Dr. Rita's Rub, the one all the way to the right. I love it, not just because it's Dr. Rita's Rub, but it's because when you have the roller ball, you can apply it very easily and fast and not have that smell on your hands. I personally like using my cream at night so that as I'm sleeping, that CBD is working to reduce inflammation. So during the day, I do my roller ball. during the night, I apply my cream. That's just me, how I do it. We also have lotions, we have lubes, we have so many amazing products that you can really use for those who have asthma. If it's you, if it's family members, please give them this information. You want to store your CBD in a dark, cool place so that it absolutely keeps its ability to continue to work. The shelf life is a year on our tinctures. The shelf life of our gummies is 6 months. So you're using these products quite frequently and they won't be hanging around, but you want to keep them out of direct sunlight. You want to keep them out of extreme heat, and you want to keep them in a nice, cool place. So it's just that simple. CBD is a healthy alternative. Again, we can't make claims that our products would cure your asthma, but we can show you that CBD can be an alternative, an additive, and an absolute way that you can address symptoms that those who have asthma. So that's all for me for tonight. I'm going to stop sharing. I want to entertain any questions. This is just such an important topic that when you see the recording on our Facebook page, you want to share it with every single asthmatic that you know. You want to give them this information. You want to also remind them that they've got to incorporate a diet that's free from dairy. You want to reduce as much mucus, and you want to reduce inflammation. You want to get them in our bitters challenge, because the bitters challenge will help detoxify and will help them to get on the right track as it relates to their diet. Get them in the bitters challenge, get them on these products, and get them the recording. So I'm going to take any questions if you have, and Erica, if you have any comments. I'm going to see as you're saying anything, we're going to take questions.
So Dr. Rita, I just wanted to say thank you because I was interested in this topic because my son, who's 19 this month, came over with his girlfriend yesterday. He picked her up to take her to urgent care. And so something that Vinny said really struck with me, because she went to urgent care and they said, well, we don't really know what's going on. She couldn't breathe, right? She was having a lot of difficulty breathing, but they didn't give her any kind of diagnosis. But she's had asthma symptoms. But she didn't think it was the asthma. But what Vinny said was that it's difficulty getting air out. And so she didn't equate it to be due to her asthma. So this was important. I was kind of thinking that maybe it was related. So I had been looking for a webinar from you so that I could let her know so she could look at it and before I gave her any products to try. So guess what? I'll be calling her to let her know she should try it. And it also is important because unfortunately my son right now is working in an ice cream store. So I don't know if she's spending more time
Eating ice cream.
Right, exactly. On top of the fact that the weather in Maryland is just crazy, like everybody else, but it's crazy, and all the pollen and the weather changes and all of that.
Yeah, you absolutely want to make sure she's off of dairy, because dairy is just building mucus in those bronchioles. Want to make sure she's not eating a lot of fast food, processed food. Right. All of those foods are inflammatory, so that's going to cause a lot of inflammation. And when we do that, it helps the CBD to work better, right? Mm-hmm. If you're taking CBD and you're still doing a lot of the things that's causing a lot of the inflammation and mucus buildup, then we're not really getting anywhere. Also, make sure she gets that bottle of black seed.
Okay.
Add that black seed on with the tincture as well.
Got it. So, and then also, I'll just add that, and I don't know that this is true, but my daughter has had asthma since she's been up since an infant. And so she has all kinds of allergies that would ignite her. It was a trigger for her. And even things like she was allergic to the trees that produce different fruit. So when she would eat certain things, I forgot what it's called, but she would eat certain things and she'd have the same kind of symptoms, like an allergic reaction, but they always ended up in being, she couldn't breathe. So It always landed her there. So we've been dealing with that for a long time. But I realized that recently she ended up coming back home due to COVID. And all of my kids, my entire family, my husband and all of us, mine is for MS, but we all are on CBD. And she hasn't had any issues since she's been here. So I'm just wondering, like even now it's seasonal, all the things that are happening right now, she hasn't had any issues. So I didn't equate it to that. She takes it usually for anxiety. She has some back pain issues.
That's
But I'm
so
like, So, yeah. So anyway, thank you for letting me share.
You're welcome. It's always a pleasure. Always. Let's see. Black seed oil and CBD are really helping. Yes, they are really helping, T-Mac. I was trying to move you over, but you don't want to come over. I don't know. I moved the wrong person over. This question is from my new client, Monica. How does CBD work with sickle cell anemia, pain crisis? What's best products? Her son is 24 years old. Ernestine Davis, give me a shout out by emailing me this, ritamd@wakanna.com. I will address sickle cell and we'll get you that recording as well. Debbie says, I know this helped me as well. My son is dating this girl that has really bad asthma. I asked her to come on this call tonight, so I hope she's on. What's her name, Debbie? We'll see if she's on. Jules says, I want to give the coffee to my grandson who has asthma. How should I tell him to use it? Jewel, how old is your grandson? Carolyn says, no question, but want to thank you for sharing this valuable information. I will share it with my customers. Roddy says, I take my asthma medication every day, but every now and then I get woken up with attacks, and that's really scary. I can only imagine that's got to be really, really scary. Oh, your grandson is 30? So your grandson should do 1 scoop in the morning and 1 scoop in the afternoon. I like doing it twice a day. He can also, you can be very creative with the coffee. I put the coffee in my smoothies some days. Some days I'm, not wanting to drink coffee, so I put it in my smoothie. You can also put it in your oatmeal. You can mix it with your oatmeal. I have a combination of oatmeal, my coffee, and this powdered low-fat peanut butter. It's so yummy. So you don't have to drink it hot or cold. You can be very creative. But a 30-year-old, yes, twice a day. There's a little scooper in there, 8 ounces, 6 to 8 ounces of water. Put in your smoothie, put in your oatmeal, and you're good to go. Wonderful. Let's see if there's any questions on the Q&A. And if anyone on the Medical Advisory Board, if you want to add anything before we close it out. Winnie, thank you, Winnie. You are the best as well, Winnie. Any questions at all on the Medical Advisory Board? Anyone want to unmute themselves? Winnie is in the healthcare field as well. Winnie, we need you on the Medical Advisory Board. She is a nurse, so. Judy Grant, are you on the line? Let's see. I don't see a Judy Grant, but Judy Grant, if you're on a different line or phone number, let us know. That would be great.
Dr. Rita, somebody asked if you can add the water soluble to the coffee, which I know you can, but I don't think you're answering.
Yes, you can add the water soluble to your coffee. Yes.
I do it every morning.
Yes, it's wonderful. You can add it to your coffee, your tea, your water, your smoothies. And that's what I love, the beauty of our products. There's so many different ways, and we want you to layer the products. We want you to get that CBD in a steady state in your system, so it's always working. And we want that to happen till you really get that inflammation under control, and then you can start backing off and have more of a daily sort of preventative dosing. But as we're trying to get results, we want you to use the tincture twice a day. We want you to use the gummy at night. We want you to use the topicals throughout the day and at night. We want you to use the smokables when needed for those acute situations. Again, I would not personally recommend a smokable to an asthmatic, but I would recommend a smokable to an asthmatic if they smoke cigarettes, because we want them off of cigarettes.
Just use my Hemp MD. It's right here.
Yeah. Can you
As
add,
you were talking, I use it.
can you
And
add
black
cream?
seed.
Ah, I love it. Can you add cream and stevia to your coffee? You can add whatever you like to your coffee. Our coffee, Jewel, is so smooth. I drink it black. That's how smooth our coffee is. I don't need cream. I don't need stevia. I don't need anything but the coffee. Yes, you can put that flat belly coffee in your smoothie, Ernestine. This author, my grandson, is in the hospital as we speak, had an appendix taken out. Can I give him CBD? So, Arthur, you're going to email me at ritamd@wakanna.com. I'm going to put that here. Any non-asthma questions, just give me an email and I will respond to you, okay?
Hey, Dr. Rita,
ritamd@wakanna.com. Yes.
it's another Q&A question. It's a non-asthma question though, but my son is 41 and his blood sugar is over 1,000 a week ago. It is now down to 234. He's on insulin 3 times a day. What should he do?
Yeah, he can email me as well.
That's Jerry.
ritamd@wakanna.com. Oops. Did you get my email, everyone? I love getting emails. Okay. Well, perfect. It's 2 minutes to 9. We had a great conversation. Hopefully, if you are a guest on the line, you will really connect with the person that invited you. We want you to do that so you can get your products ordered. We really want you to lock arms with us here at Wakanna and support the person that invited you for your overall wellness, right? Also share the recording with anyone that you know that has asthma that didn't make it on the line tonight. And we want you to see us next Wednesday. Every Wednesday we have a different topic that we explore, we talk about, and we look at how CBD can assist. Not cure, but how CBD can assist. So be well, be safe. Have an amazing rest of your week, and we'll see you next Wednesday. Thank you, Erica, as usual, for your input. Thank you, business partners, for showing up. And thank you, guests, for joining us tonight. Have a great evening.
Good night.